Very good morning and welcome to Apollo 24/7's Health Hour. This Sunday is a very special Sunday, October 2nd, Gandhi Jayanti, and also Navratra, as Navratri is being celebrated in full fervor. Let's talk something which is very, very important. We are going to talk about ways to manage depression. Depression has been for a very long time not so talked about topic in mental health, where mental health entirely was put out to a side, under the carpet, never addressed. But today we are hearing so much about depression, and we thought, let's talk about depression and how do we manage this. So we are bringing you an Apollo's expert, consultant psychiatrist, Dr. Bharghav Sirivelu, to our show today. Join us live, and then we are going to take your questions very shortly. Dr. Bharghav Sirivelu is consultant psychiatrist at Apollo Hospital's Greams Road, Chennai. He is joining in from Chennai, who has experienced last 7 years से इनका experience रहा है, and he specializes in adult, geriatric and addiction psychiatry. Dr. Bharghav Sirivelu can be consulted for mental health disorders in all age groups, mood disorders, psychotic disorders, addiction disorders, drugs and internet, sexual health issues, counseling and therapy sessions also can be done with Dr. Bharghav Sirivelu. So on this show, we are going to take your questions. We are going to put it to Dr. Bharghav Sirivelu. We're going to get you answers. Also, there'll be a health quiz where you can participate and win prizes. So I'm going to welcome Dr. Bharghav. And yes, good morning, doctor, and welcome to the show.
Hello, very good morning to you and our viewers as well.
Thank you. Thank you so much, Dr. Bharghav. We know that we generally don't talk about mental health issues, and there's so much of stigma attached to mental health issues. It's only recent times, may I say, it's only been last few years, 5 to 10 years, that people are open about discussing mental health issues.
You're absolutely right in saying so. As you said, mental health itself, speaking about mental health itself, there is a lot of stigma, and people are really worried, or that stigma stops them even discussing about the mental health, and which is very much of a need of the hour. And you see, after COVID, I think probably the importance of mental health issue was in a limelight. So I'm very glad that discussion is happening on this very much wanted topic, so that our viewers are much aware of these issues and get them addressed if needed.
Perfect, sir. Very well said that it's a need of the hour, and especially COVID. I think it's a very important topic that we need to talk about, COVID and mental health related issues as well. We will take that up very shortly. Just for the convenience of the viewers, if you're watching it on YouTube, we would request you to, in case you want your question to be answered, please place your question on the YouTube chat box. If you're watching it on the Facebook, that's fine. If you want your query to be answered, you please type it in the YouTube chat box. For example, I can say, yes, the video is lagging, Divya Krupa. They're trying to rectify it. Sumitra Shankar Sahai, yes, we are we're trying to get things sorted. But yes, please be with us. This is a very, very important topic. Dr. Bharghav, quick question before I start. Let us understand what depression is. Would you want to, what is the, what do you call the meaning, or how do you say? How do we understand depression?
So, perfect question to start with. See, a lot of us think depression is sadness, or depression is feeling upset. But you should understand, when we speak it in psychological terms, sadness, feeling upset, worrying, they're all natural experiences which we all go through. I feel sad, you feel sad, everyone feels sad. But understand, when we say depression, that means when a person undergoes these kinds of negative experiences, especially pervasive sadness, when I feel sad for most of the time in a day, most of the days in a week, most of the weeks in a month. Second thing, when I feel lack of interest, immotivation, when I feel lack of energy, all these kinds of negative symptoms which are experienced for a prolonged period of time, probably that indicate depression disorder. That is what we call it as depression disorder. Disorder means all these negative symptoms are going for long periods of time to an intensity and extent where they're affecting a person's day-to-day life. So this is very important to know that sadness is not depression, feeling upset is not depression.
So, sadness is not depression. Let me reiterate what doctor said. Feeling sad and then also feeling low is not depression. Right, doctor? What's the other point you said?
Absolutely. So feeling sad, feeling low, it's their natural emotions when they are experienced for prolonged period of time. Prolonged period of time. That is when probably you should consider this as depression disorder.
Right, right. So how do I understand and term what depression is? For example, if I'm going through as a person, individual, how do I understand that this might be depression? And how does a person, like if I'm a caregiver, if I'm a family member of the person who is going through this, how do I understand?
Right. You see, that is what, as I said, the criteria or DSM or ICD, that is what we say, the criteria where you should put a person whether this is normal sadness or depression disorder. They say, like when a person goes through certain set of symptoms for more than 2 weeks, if you observe these three symptoms, one is pervasive sadness. Sadness which is experienced for long time. Pervasive sadness from morning to evening. I feel low, doctor. I feel low most of the time in my day, doctor. Second thing, apathy. I'm losing interest in the activities which I used to enjoy before. I used to enjoy gardening. I used to read books. I used to be a very lively person. But no, I'm not feeling so. And this is happening for more than 2 weeks. Third thing,
How many weeks?
lack
Doctor,
of
I'm sorry?
2 weeks. 2 weeks to 1 month
More
is
than
what
two
we usually.
weeks.
Yes,
Ah,
yeah. And third
okay.
important thing is lack of energy. Doctor, I'm eating, drinking, everything I'm doing, but still I feel a kind of lack of energy. So these are the three cardinal signs where if you notice in yourself or in your dear ones for a long period of time, more than 2 weeks, probably you might have to consult a professional to demarcate whether this is going to be a clinical depression.
So for years, we didn't even identify that this is a problem of concern, and this has to be, the issue has to be taken to a professional. Now that we have so much of mechanism around mental health and then help is available, who needs to be consulted? Where do we first go if you are finding these symptoms that you have told us before?
See, ideally, there is a big confusion in people's mind as well, whether I should meet a psychiatrist or whether I should meet a psychologist. Who are these two guys?
True.
What are they going to do? See, understand, uh, not exactly, but still I can put it in this way. All right. Suppose you should understand you broke your arm. Okay. You can't run to a physiotherapist, right? You should go to a doctor, get an X-ray done, and doctor would suggest yes, do this, and then go to physio for strengthening your muscles. So this is how probably the psychiatrist should. When you feel the severity of the symptoms is high, to an extent I was saying, right, it is disturbing my day-to-day routine, doctor. इसकी वजह से these symptoms are not making me do my job. These symptoms are affecting my personal life. And now if you feel the severity is very high, probably the psychiatrists have to be consulted. Of course, once your assessment is done, depending on the symptoms and the severity, he might guide you to a psychologist. Yes, it's not every one of us require medications, right? Psychiatrists or medical doctors, psychologists or non-medical professionals. So, based on this severity, let us leave the decision to the doctor whether yes, you require a medicine, you don't require a medicine, please go ahead. So it's just like again the orthopedic example. Is it a sprain? Is it a fracture? Is it sprain? Yeah, just go to a physio and just get it right. Not nothing. So kind of, right? So hope I've made it clear now.
I got the point. So गुना जी पूछ रहे थे डिप्रेशन और सैडनेस के बीच में फर्क क्या है? I think you have answered the question. गुना जी थोड़ी देर पहले ने क्लियरली बता दिया था कि ये सैडनेस है और इसको डिप्रेशन में क्लासिफाई कर सकते हैं. By the way, Dr. Bharghav Sirivelu and I talk Telugu. So for the viewers in Telugu, quickly Bhargav garu ఒక్కసారి audience కి తెలుగులో చెప్పరా డిప్రెషన్ కి సాడ్నెస్ కి తేడా ఏమిటి అండ్ సాడ్నెస్ అండ్ డిప్రెషన్ రెండు ఒకటేనా కాదా?
డిప్రెషన్ మానసిక కుంగుబాటు అంటారు, లేకపోతే మానసిక వ్యాకులత అంటారు. సో సాడ్నెస్ అంటే ఈ డిప్రెషన్ ఎట్లాగంటే అండి, ఈ చాలా రోజుల తరబడి కానీ వారాల తరబడి కానీ ఒక మాదిరి లో మూడ్ ఉండటం, ఒకలాగా ఇంట్రెస్ట్గా లేకపోతే నాకు ముందు మాదిరి ఇంట్రెస్ట్ లేదు డాక్టర్, ఇంట్రెస్ట్ తగ్గిపోతుంది డాక్టర్, లేకపోతే నిద్ర ఇష్యూస్ వస్తున్నాయి, నిద్ర సరిగ్గా పట్టడం లేదు, ఇంకా కొంతమందికి సివియర్గా సూసైడల్ థాట్స్ రావడం, ఇలాంటివన్నీ మనం కొన్ని రోజుల తరబడి వారాల తరబడి ఎక్స్పీరియన్స్ చేస్తున్నప్పుడు దాన్ని డిప్రెషన్ అంటాం. సాడ్నెస్ ఈజ్ సిమ్టమ్ ఆఫ్ డిప్రెషన్. సాడ్నెస్ అనేది ఒక సిమ్టమ్ ఆఫ్ డిప్రెషన్ గా తీసుకోవాలి వెన్ ఇట్ గోస్ ఫర్ ఎ లాంగ్ పీరియడ్ ఆఫ్ టైం.
అంతేకాని ఈ రెండు ఒకటి కాదు.
ఒకటి కాదు. నేను అయ్యో డాక్టర్ నాకు బాధగా ఉంది, నేను డిప్రెషన్ లో ఉన్నాను, కానీ కాదు. ఓకేనా, అందరూ బాధపడతాం, అందరికీ కోపం వస్తుంది, అందరికీ సంతోషం వస్తుంది, ఇవన్నీ కూడా న్యాచురల్ ఎమోషన్స్ గానీ తీసుకోవాలి. ఎప్పుడైతే ఇవి మన దైనందిక జీవితం డే టు డే యాక్టివిటీస్ ని రోజువారీ పనుల్ని అఫెక్ట్ చేస్తుందో అప్పుడు దీన్ని కొంచెం ఒక డిజార్డర్ గా తీసుకోవడం, డిజార్డర్ గా చూడటం, డాక్టర్ గారి దగ్గర వైద్యుల దగ్గర పోయి సంప్రదించి దానికి తగ్గట్టు ట్రీట్మెంట్ తీసుకోవడం వల్ల ఉపయోగాలు.
Thank you so much. It sounds so much more profound in Telugu. Thanks. That was for the Telugu audience who are watching it from Andhra, Telangana, or elsewhere. Now let's continue with one quick question before I take audience's question. Also, doctor, I think I'm not able to figure out if it's my internet or my technical side that is lagging, or yours, or overall I'm not understanding. But do you find the lag as well?
Yes. I even find the lag. Yeah.
Yes, but let's continue because there are a lot of audience who are waiting for their questions to be answered, and I hope the technical snag will resolve by itself. I'm just hoping that things come and fall in place. So one quick question before I continue with audience's questions. A lot of times we do think that because I'm weak-minded, I'm fragile, or I'm emotionally very unstable, that's why such people only get into depression, not the strong-minded, able-bodied people don't get into depression. Is that true? What are the factors that one can lead to depression?
A very good question, madam. See, we all think, okay, fine. We receive a lot of clients saying that, doctor, he has everything. Why should he get depressed? He has money, he has success. Yes, why should he get depressed? No. It's just like saying Mike Tyson should never get common cold because he's fit, he's fine. Why will he get common cold? See, understand. See, depression is a disease of mind. It can affect you, it can affect me, it can affect every one of us because of certain biological or environmental factors plays a role. It's not a sign of weak mind, it's not a sign of fragile mind. As I said, every one of us can go through this disease, can suffer from this disease of mind due to multiple factors around us. So even the World Health Organization says mental health illnesses or mental illnesses like depression, anxiety, XYZ should be considered as physical illness. There is no difference between this. They should be considered as physical illness. It's not like, okay, fine, only when you're a weak man you suffer from depression, you're a very strong miracle, itna willpower, doctor, I'll never suffer from depression. No, that's what I was telling. Mike Tyson says, no, I've been fit for 40 long years, I'll never suffer from common cold. No, that's not going to happen.
So while we're talking about depression being a mental health issue and then which is not visible, but as you are saying, it can be manifested in physical forms as well, though it has to be understood as a physical illness ke tarah hi usko samajhna chahiye. But will it also impact your physical health, and what are the impacts?
Very importantly, a lot of people again think depression or any mental illness happens only up there. Again, that's a very wrong notion. That's a very wrong notion because mind and body are connected. Mind and body have a strong connection. They're not two independent organs in your body. Okay, I'm telling. See, naturally, when you see this depression, it also affects your physical health. फंडामेंटल और मोस्ट कॉमन साइंस ऑफ फिजिकल हेल्थ इशू इज स्लीप डिस्टर्बेंसेस. मेरे को पहले जैसे नींद नहीं आ रही है डॉक्टर, आई एम नॉट फीलिंग, आई एम फीलिंग लॉट ऑफ स्लीप डिस्टर्बेंसेस. One important thing, as I said, one of the cardinal symptom of depression is lack of energy. I feel weak, doctor, for no reason. I feel weak. And third important thing is a kind of body pains in few patients with I see pain here, I see pain here, I see pain here. I suffer frequent headaches and very severe cases of depression. We even see loss of weight.
Yeah, yes, yes, yes. I have seen a lot of my friends going through such bouts. And one quick question, and a last question from my end, and I'll take up audience's questions. While there's a very, very close friend of mine who was taking help and treatment and counseling sessions that she was going through, but there were bouts of these depressions which were coming back. She was suicidal for a very long time, then she came out of it. But then, is this not manageable? How long will this depression ka bout last? And is it recurring?
Uh, Usually, when we speaks about these bouts of depression, there are various depression disorders. Like there is something called bipolar depression, there is something called depression disorder. See, usually that depends on a person to person. It's not like a particular time frame. Everyone of again, when I compare it to a physical illness, doctor, I got COVID, I recovered in 2 days. Doctor, my friend got COVID, he recovered in 1 month, right? So telling a time frame, I feel it's inappropriate. So most of the cases, with an adequate treatment and the right forms of treatment, early the treatment has begun. I started experiencing, I go to the doctor, immediately get it addressed. Yes, we see a good prognosis within a short period, even 1 month to 6 months. That is what we see a good recovery in these patients. 1 month to 6 months somewhere. Oh, okay, doctor, I don't feel. Okay, my parents said or my friends said, don't go to doctors. They give you some sleeping pills. No, don't go to psychologist. No, that might take a long duration, might even worsen. Just like going to a hospital after everything has been happening. So the time frame is very important. The early you get it addressed is very important for a better prognosis and a recovery.
वेरी वेल प्लेस्ड डॉक्टर. सो देबाशीष जी का क्वेश्चन के साथ मैं शुरू करना चाहती हूँ ऑडियंसेस के क्वेश्चंस. हाउ लॉन्ग डज इट टेक टू गेट क्योर्ड फ्रॉम डिप्रेशन एंड स्टॉप मेडिकेशन? दिस इज अ वेरी वेरी इंपॉर्टेंट क्वेश्चन बिकॉज कि ड्यूरेशन कैसे डिपेंड करते हैं एंड पीपल आर ऑलवेज इन दिस माइंडसेट दैट आई डोंट वांट मेडिकेशन, मुझे मेडिकेशन अवॉइड करना है. So what is the right time to stop medication, and can medication be stopped in case somebody has been prescribed medications?
See, that is what. Usually, it takes somewhere around 1 month to 6 months, depending on every person, because lot of factors play a role here. How fast it was diagnosed, whether that was man or a woman, even that plays a, whether they have any
Gender
other
plays a
physical, whether they have any other physical comorbidities like hypertension, diabetes, thyroid. So all these factors depend on how fast you recover. And the question on medicines, see, very importantly, you should understand there are the antidepressants which we usually give for depressive pain. They are safe medicines, nothing to worry. So I keep asking my clients, see, what are the side effects of white rice? They say, doctor, if I eat a lot of white rice, I get a lot of cholesterol. Then what happens? Doctor, I get diabetes. Then what happens? Doctor, I get cardiac issues. Then what happens? Doctor, I die. So literally you're saying if you eat white rice, you die. Okay, did we stop taking it? Did we stop taking this? No. See, everything which jumps into you will have certain amount of side effects. But understand these medicines like antidepressants, they're comparatively safe, nothing to worry about it. In fact, they improve your quality of life when you're under depression. So, coming to the duration of the medicines, as I said, 1 to 6 months. And yes, if the recovery is fast, we can even stop it well before. And doctor will advise you how to gradually taper and stop it, because a lot of people does this mistake. I felt better, doctor, so I just stopped it. No, never do it, because there is a way you need to taper the medicines so that will not give you any kind of uncomfortable feelings when you suddenly come off the medications. So hope I've made the thing clear.
Yes, yes. So here's a question about bipolar. So Ankur Agnihotri is asking this question. What is bipolar? How can that be managed? And he's asking for some tips. And is it different from depression, or can a person with bipolar also have depression simultaneously?
Right. All right. See, bipolar disorder is a different entity. It's altogether a different psychological mental illness, actually. See, bipolar disorder is characterized by two things. Bi indicates two, all right, poles,
Two.
two poles. One is depression, one is mania. All right. So when you see a patient or a person with bipolar disorder, you can see them experiencing these episodes of some days I'll be very depressed. Again, I'm saying this episode should happen for weeks together. I'm depressed for more than 2 weeks, 3 weeks, 4 days. Suddenly, I become normal after some time. And sometimes I might get into an episode called mania, where I feel very hyper elated, excessive talk, grandiose, right? I stay in that place for some time. Again, come back to normal. So it's like
Yes.
two or three sorts of depression, mania. It's a different psychological illness altogether. And yes, as I said, it's considered a severe form of psychological illness, but absolutely this even has a cure. We see a lot of bipolar patients successfully running as big entrepreneurs, and who manages some thousand people around them. So every mental
So this is
health has an answer.
This is
As
such
a
a positive thing that you have shared, doctor, because just by knowing that there is help and it can be helped with, a lot of things can be changed. So, such a
Absolutely.
good news that you shared with us. Yes. So yeah, so let's not get into bipolar now. I think we should do a separate session as we're talking about ways to manage depression today. So let's talk about Sundar Pandyan's question, who's a 45-year-old male who is asking us, how does one recognize the symptoms of depression in themselves, and when should I seek help?
Right. See, simple. I think all our viewers need to note this point. Okay, simple ways to diagnose depression. As I said, make sure you note down three symptoms of depression. If you see any one of them going for more than 2 weeks, or not even 2 weeks, if you see they are impacting your day-to-day routine, it might be work, it might be social life, it might be personal life. Immediately consult the doctor. What are these three signs? As I said, my low mood. I'm feeling low for most of the time in a day. Yes, be a little alert. See, observe whether this is going for a long time. Second thing, I'm losing interest in previously pleasurable activities. I used to enjoy, but now I don't think so. I'm enjoying this. I don't think so. I'm any kind of मेरे को मन ही नहीं आ रहा है डॉक्टर वो काम करने में. That is, yes, be a little alert. Third important thing, lack of energy. I'm feeling weak for no reason, unexplained weakness. Associated symptoms. This, like sleep issues, feeling helpless, feeling hopeless, or you feel some death wishes or suicidal thoughts. These are associated. So, first three are cardinal symptoms. You see them little intensely, a prolonged period of time, interacting with your day-to-day routine. Please consult the professional.
Perfect. And thank you so much for highlighting it, because how many other times that we talk about this, or the more that we reiterate, there's going to be a lot of benefit, and we should be spreading this message out. Identifying the symptom is the first step. Right. And Sachin Pawar ji ka question, I'll continue. 34-year-old male hai. See, he's having morning anxiety, low energy in the mornings. And how do I stay motivated while living in a toxic environment? And this is something, is this depression, or are toxic environments leading to depression, or while being in toxic environment, depression बढ़ता है, ऐसा कुछ है क्या? Is there a relationship between these two?
So this is a very big question, I think. Okay. So one important thing you should understand is when we say toxic environment, like the psychologically we call it a stressful environment. Okay. See, there is a nice explanation in psychiatry where we say biopsychosocial factors, biopsychosocial model of depression, where
Okay.
a person can experience depression due to some biological reasons, neurotransmitter imbalance, or certain biological, certain psychological reasons. where I become more negative, my negative emotions, my negative perceptions, my negative attitudes. Social factors do play a major role here as well. Stressful environment, as he was saying, toxic environment. All these are factors which can make a person vulnerable or at risk to develop depression. So, depression is multifactorial. Second important thing, yes, whether stress causes depression, as I said, not like stress will definitely cause depression. Stress makes a person vulnerable to depression. If you manage stress in a perfect way, probably you can just deal that you might not even suffer from depression, or you might not make it happiness. So very importantly, the stress should be managed. Again, that is what I wanted to answer here, because a lot of people say stress. You see stress management, you see stress, you see stress. See, understand, stress is a part and parcel of our life. You cannot you
जी.
cannot uh, 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 live a day without stress. Till your last breath, stress is there. So we need to know how to deal with the stress. Or there are some interesting studies which also say stress is a motivator. Stress motivates a person. So use stress, we call it as understand. So dealing with the stress should be an answer. And of course, stress or stressful environment makes a person vulnerable to depression if it is not dealt in a particular way. And you should also be aware of biopsychosocial factors of depression. We need to balance all these three factors to make ourselves play a kind of safe role.
Yes. So Krishna Chaitanya and a few others are asking about food. Can we control depression by any way of these natural methods or food? And I did see somebody asking about meditation and exercise as well. So would you want to throw some light on these aspects?
That's a good thing. See, that is what, there was an earlier question where, is that I'm in depression, whether I need to take meds for sure. As I said, mild forms of depression most of the times might be brought under control by this natural ways. It might be dietary changes, it might be healthy lifestyle habits, it might be walking or exercises kind of thing. Yes, that is definitely there. So when it comes to diet, yes, there is no stipulated diet for depression, but there are certain foods, we call it as serotonin enhancers. Serotonin is a small neurotransmitter which usually say depressed patients, the levels fall kind of. So naturally, the omega-3 fatty acid. I tell all my clients, take nice amounts of water. Water is an antihistaminic, and naturally, it is an anxiolytic as well.
Something prompted me to take water.
So, nice amounts of water, timely food intake, and make sure you have a kind of Mediterranean diet. It's a colorful plate, some carrots, red, green, blue, and red, green, brown kind of things. And especially, a few studies says this omega-3 fatty acids or kind of antioxidants will definitely act as neuroprotective agents for your brain, so that they give a kind of shield for your brain, so that you're not at risk for depression. So I think foods which are rich in these kinds of things. So when I say serotonin enhancers, yes, all this curd and natural ghee, all these are serotonin enhancers. A timely food itself is a serotonin enhancer. Okay, yeah. So
That's interesting. Very interesting.
that's,
So yes,
yeah.
कृष्ण चैतन्य जी, आपने जैसे पूछा है कि serotonin enhancers help करते हैं क्या, and can they be taken in any other form, medical form, or do they have to be only through food?
See, ideally, yes. As I said, in some cases of depression, we do give some supplements, right? Like vitamin E, or antioxidant, or sometimes even folic acid. Where you see this pregnant women taking folic acid. Why do they take folic acid? Because the neurodevelopmental thing in the baby, they want the baby to be more neurologically ill. That is a neuroprotective agent. The same thing holds good for you. We give these supplements. Definitely, they will make a change, or they help to boost the mood, as well as reduce the symptoms of depressions in certain cases.
Wonderful, doctor. So, understanding that these food has a major role, Does also exercise play a major role in controlling depression or maintaining depression or
The,
managing depression? I'm sorry.
the very important question every one of us should listen to, because do exercise, drink water, regular doctor's advice. Every doctor will say this. People have come to that extent saying that, what is this? Okay, I know I should do exercise. It's not like you should tell me. So very important when it comes to psychological illness. There is one doctor, Dr. John Ratey from Harvard. He has written a book, The Revolutionary New Science of Exercise and Brain. Okay, he says, you take an antidepressant, or you take some food, or you take a supplement, you take some kind of a support. All this will take some time for you to make better. Suppose I'm taking fish daily, I'm taking milk daily, for it to improve your calcium levels or your health, overall health. It takes some time. It's not today I take fish, tomorrow I become Hulk. No, nothing like that. Okay, it takes time. Okay, but exercise gives you an instant uplift in your brain. So, in the sense, what he says is, once who do it, once you're done with your exercise, your brain areas get stimulated in certain way. That helps to release some endorphins. The blood flow increases. There is something called the neuronal connections improve in a vital brain areas, making your cognition, intelligence, concentration, attention, and overall brain functioning better within 5 minutes of your exercise. This is the importance
Right.
of exercise
So,
in.
yeah, is my audio clear, doctor? Are you able to hear me well? I think I'm experiencing a technical glitch. If my audio is fine, here's my next question about sleep. I'm unable to sleep. I'm unable to concentrate, focus. My studies or my work is being affected. This is Raudralok Chakraborty, Ankit. Then there is also Fayaz, Aryan. A lot of people are asking about sleeplessness. So, how do we address sleeplessness? Is this leading to depression, or is it because of depression that people face sleeplessness?
Recently the studies were saying we are going through a sleepless pandemic or sleep disturbance pandemic. Okay, almost, almost every one of us are experiencing sleep disturbances nowadays, right? Some or the
Right,
other day.
right.
Very important. So now, coming to, or trying to filter it out to depression, yes, it's both the ways. Sleep disturbances can be considered as one of the symptom of depression, or lack of sleep due to improper lifestyle, any other factors might as well create a kind of mental fatigue which might increase the risk of depression. It's both. The second thing, how should I manage it? First important thing, as I said, a proper routine, a proper sleep hygiene is what we say. Sleep is not something I close my laptop, I should sleep, doctor. Please don't form that opinion of sleep is like a dinner. You need to go to market, get the veggies, boil, cook, serve. That is when you can enjoy the sleep is something you need to prepare for. Make sure you have a proper routine throughout the day. Make sure you have a timely food. Make sure you come and fix a sleep time and keep off your gadgets when you sleep. So all these sleep hygiene techniques are very important so that you enjoy the sleep, right? And second thing, if the sleep disturbances persist, as I was saying in few clients, that will be so troublesome. Mornings, they feel very groggy, or they feel very tired, weak. Probably you might have to get it addressed with a doctor. There are certain medicines of trying to find the underlying cause is very important first. It's not you have a sleep issue, you take a sleep. No. Lot of us see this. Doctor, I know some doctor gave me Restil. Doctor, I don't know some doctor gave me Alprax for 2 days. No, please don't do that. Don't do that. That's very important. Okay. So you need to get it, find the underlying cause, whether am I doing anything wrong? Yeah, let me correct it and see whether my sleep regularizes. Or is it something very disturbing? Now let me get it addressed, either with the medicines or, as I said, certain other ways. Right?
Yes, doctor. So while people are talking about, I've been taking sleeping pills for a very long time, still doesn't help. So Ruchi is asking. So people who think that they require pill to sleep better, and then they get addicted, or can I use the word addicted, or get
Yes,
used to here with this?
absolutely. It's perfectly an apt word now.
Okay. So somebody like Suruchi who's unable to sleep and she's been taking sleeping pills for a very long time. How safe is this? Especially when while there are medical professionals and experts like you who promote, who say that please come out, take medications, and we are apprehensive of taking a proper prescription medication, but over the counter, we don't mind going out and buying these
You're right.
anxiety reduction sleeping pills. How good is this for us?
See, very nice question, very important question again. One thing, when it comes to taking sleeping pills, yes, lot of us think sleeping pills is an answer, right? Please come
Yes,
out of that
I know
question.
my own circles that they think
I
that it
think
is
at least two of our family members will be on sleeping pills, let me say. Okay, when you have a family.
true.
Say, I'm telling you, as I said, sleeping pills, yes, it should be first of all to be taken under a after a doctor's prescription. Which usually doctors will not prescribe it for more than 2 weeks or max 2 months. Okay, because that is all what is necessary. Over the counter medications, especially the sleeping pills, the potential of them getting, it's not just addiction, Jansi, it's more or less tolerance they develop, which is a threatening and a dangerous phenomena. Doctor, पहले मैंने एक दवाई खा रहा था, अभी I'm not getting that effect with one tablet, I start taking two. You see this,
True.
it's just like taking an alcohol, right? पहले मैंने I've used to take 30, doctor, now I'm not getting that pleasure, I just increase it to 60. You see, is there any difference between both? The same thing happens with that is where I'm telling addiction. You might get into a dependency on these pills. And taking sleeping pills for long durations of time will have enough side effects. Okay, it will destroy a sleep architecture. First of all, and it will destroy a sleep architecture if you go ahead with over-the-counter pills for a long time. Second
Right,
thing,
right.
have an effect on your brain. The risk of dementia-like illness is very high when you just start the pills in the early part of your life for a long periods of time. And third thing, as I said, the physical issues, the benzodiazepine withdrawal or benzodiazepine dependence is what we say. It's going to take a toll on your physical health. So it is a very risky behavior to get into these sleeping pills, especially if not guided under doctor. Yes, certain people might require it for a brief period of time. But yes, that is where the professionals come into play, try to rule out the underlying cause, get it addressed. As I said, see, you get COVID, you cough, right? Doctor Miracle, just give some tablet for cough, give some tablet for cough. No, no, no. You should treat naturally when you treat COVID, cough for a brief period of time because it is very interacting. Naturally, the cough comes down. Yes, doctor, I'm getting COVID, I'm getting fever. Give only pill for fever. No, no. You treat COVID, naturally fever comes down. Similar thing. Sleep issues are a kind of tip of iceberg. It indicates something under you most of the times. Most of the times, it
Yeah.
indicates some underlying. So get it addressed so that the sleep. This is the right strategy rather than just jumping into getting into the sleep. Yes, right?
Very well said. I think a lot of people will find an answer for their query. Ayan Raj, who's 29, who has trouble sleeping or no sleep. So I think you must have found your answer. There must be something else. It's not the sleep, it must be something else. Please do consult Dr. Bharghav Sirivelu or the entire plethora of options that you have on Apollo 24/7. Quick question from Swaminathan ji's question. In fact, it should be my question also because I have a lot of teenagers at home. These youngsters don't sleep in the night. They have gadgets, they have cinema, they have chats. They are not sleeping in the night, and then they have to wake up, get to their colleges or to the work, which is affecting their productivity. Will this lead to any mental health issue because they are compromising on their quality sleep?
A very important dimension in the society should address currently is teenage mental health issues because they
Because
are very.
Swaminathan's son once, yeah, Mr. Swaminathan, who has a teenager, he says, do I need to take my child to counseling? Will this affect his health? He's unable to sleep due to his pattern.
100%. See, it's the teenagers are more like a fertile fields for any psychological issue to happen if there is something wrong going on in their life, right? It's
Oh,
not just sleeping because they're very because young ages very vulnerable and risky for these mental health issues to happen, right? So very importantly, again the proper routines should be they should be in place. If you compromise on the routines, the fundamental thing, again I'm saying, it's just like I'm not fueling my car, I'm going to 10 mechanics saying that, please, something, my car is breaking down. My car. No, that's not going to happen. Fuel it, run it. Service it, run it. Use your machine in a way it is designed to. You are designed to wake up and do certain things in the morning. You are designed to sleep in the evening. If you topple it upside down and say that, doctor, I'm not getting sleep, doctor, I'm feeling, yes, understand this phenomena, right? So 100% make sure your kid or children have a proper routine. So you can't say the kids don't use cell phone in India. No, it's not possible. Make sure that has certain scheduled timings for the usage. You can reassure the children. We call it as positive reinforcement in psychology, where, okay, buddy, use your mobile from 10 to 1. Okay, that's it. After 1, put it down and just get into some other activity. If your kid follows it, give him a hug, give him a praise, or, give him a chocolate, give him a, you see, he understands, okay, fine. I've been reinforced and let me do this, repeat this behavior again. There's are certain techniques, we see behavioral techniques we address to the clients so that they get the kids' behavior into place. And the second question, yes, absolutely. The teenage depression is it's going to be a very important dimension which affects the kids' life because they have got 100 more years to live, right? Yeah. So
Correct.
around
Correct.
7% children. 7% is what we see depression in teenagers. Again, the byproduct of all this unhealthy lifestyle. Second thing, very interesting phenomenon we observed in COVID because schools were shut, everything was. Suppose a kid requires a social interaction, a kid requires a physical activity, right? So everything was shut, and they have piled up all this negative stuff. They can't go. A kid goes to a school, he speaks with 100 children and come back. Mind is
True.
so vibrant, their minds are so vibrant, you should allow them or give them space or opportunity to express those. And now that again says that has literally given a understanding like kids have to be involved in these kinds of social interactions or physical activities because their physical and mental health status changes every day in them because they're growing, right? So this is a very
Yeah.
important dimension, and I'm happy that
So
Mr. Swaminathan.
do they need to, yes, Mr. Swaminathan, and also there was somebody else who's a children and depression ke bare mein, there was a mother who was asking, I was trying to look for her name but I didn't find. But who do we consult अगर हमारे teenagers में और बच्चों में अगर हमें symptoms दिखते हैं, how fast should we react?
So as I said, that's what the fundamental theme of when to consult and whom to consult remains the same. If the symptoms are very severe, ideally consult a psychiatrist. He will have an assessment and then guide you whether, yes, okay, madam, this is not so severe. You can just go ahead with the therapy sessions with a psychologist, right? Or if a psychiatrist is not available, that is even you can say to the psychologist, "No, please assess. If you feel it is more severe, do we have any other option? Like he might have to be on meds." Again, when teenagers and medicines, psychiatry medicines, please come out of this stigma. They are very safe medicines. I see children happily smiling after starting certain antidepressants because they come out of depression, their stress comes down, they're very happy and leading their lives in a very positive because that's going to be a very brief period of time we are continuing the medicines if and all. Okay, it's not like lifetime.
I'm so glad that we did touch this topic up. So now, while we talk about children and teenagers, let's talk about something that is your specialty, geriatrics as well. Rishabh Pokharna is asking this question: how do I deal with parents who I think are depressed but who are not ready to take help?
Very practical question. Very practical question because we see a lot of clients because suppose if I say my dad like dad, I feel you're depressed. Please go and meet a psychiatrist. What is the answer you
Hmm.
get? I know what to do. Right? Yeah. See, because the stigma we develop towards it. And yes, geriatric depression. Very interesting thing is a lot of people think geriatric depression will present with a low mood. No, most of the times it might present with cognitive difficulties. I'm not able to concentrate. I'm losing my memory. I'm not able to organize as it was. Cognitive difficulties will be very much of a presenting symptom in geriatric depression. Of course, all this low mood, lack of energy, and lack of motivation will be there. So ideally, when you see your old parents or who are staying away, suffering from these kinds of depression, ideally communicating about it and comforting them is a very important thing. Right away, call them and say, Papa, you're feeling depressed, go to doctor. He'll say, hell, I'll know. You just keep your phone down. Right? Yeah. Comfort them. Tell this.
That's not the way
Probably.
it is. As such, they are bored. They are like, they have enough reasons and, they are
You're right.
single most of the time, managing things on their own with their health, failing physical
And
activities.
one more thing the question can see. I have lived my life like this for 50 years, and now young chap comes and says, you're depressed. I know how to deal because the stigma or
True,
the
doctor.
attitude they. So understand, comforting them, communicating about it is of a prime importance. Telling them this is what, and probably if you get it addressed, this is going to be your life going forward. So that the chances of them coming to the treatment or getting it addressed at least would be very high.
But I'm glad that we did talk about it, that children and adults, especially seniors, need to take certain help and we need to figure out which way and put them to experts. So quickly, because
Absolutely.
we're running short of time as well, I'll ask two questions from two different people but going through similar condition. Gitanjali and Fayaz, both of them are taking medication for a very long period for depression and anxiety issues. But Gitanjali says it's coming back in waves. I had dengue and then that is also bringing me, and I'm going through separation, it is bringing me issues. Also, Fayaz, who had anxiety disorder and depression as well. Thus, Sal say he's been on medication, but now he feels suicidal. So, while being on medication as well, while we think that they are being monitored, are there chances that this comes back, doctor?
Right, very good question and a logical question. Let me say again, okay, it's not just I'm depressed, I take medicines, and I don't follow a proper routine. Again, I'm telling you, let us say, take an example of diabetes. Okay, why I'm comparing it to the physical diseases is the viewers will understand how to look into these issues. Again, when I say diabetes, my sugars are 400. Okay, doctor will give you a diabetic pill. Okay, you take it, it comes to 100 or 110. I go out and take half kg sweets and come back. You understand? Pill will help to
Sorry,
reduce the symptoms.
doctor, I think my internet maybe, but please continue talking. Let me refresh and
Right.
come back.
That's what I was trying to say. It's not just pills which you might have to be dependent on. It should be a combination of the antidepressants or anxiolytics along with the proper lifestyle management, which includes a proper routine, proper food habits, and a kind of relaxation which you have to bring into your life on a day-to-day basis. When you combine these both, that is when probably most of us will have to continue the meds for only brief period of time. But yes, there are certain cases, we call it as resistant cases of depression, where despite of giving medications for long period of time, yes, remain symptomatic. So that is where we might have to go for further assessment whether the tablets were given on an adequate dose, whether most of the times we see compliant issues. I skipped it for 2 days, doctor. I skipped it for 1 week, doctor. Again, I started. Sometimes these are the compliance issues, dose, whether that is adequate or not, whether we might have to add adequate doses, or whether we might have to, and as I said, with women, we say a lot of resistant cases. I have thyroid problem, and I keep taking antidepressants, no response. I have vitamin D deficiency. I keep taking antidepressants, but probably mild response. You need to underline. You need to check or evaluate whether underlying causes. So all this workup need to be done when we see a resistant case. So the point would be make sure you combine an antidepressant or anxiolytic with some natural ways like a proper lifestyle or a relaxation. So that is a best combo.
Yes. So, doctor, here is next question. Rakesh Arora ji पूछ रहे हैं, how to deal with agaraphobia and I'm suffering with this. So what is agaraphobia, doctor? So it's fear of
So,
places, not able to go to
yes,
places.
see, agoraphoobia is nothing of fear of being in public places. Okay, fear of being in public places. Okay, where when a person enters into a public place, he gets a kind of panic. I feel my heart pounds and I feel very panicky about it. Okay, that is very important. See, it is again a form of anxiety. We call it as panic. It's very simple to deal with it. Usually, there are a lot of psychological techniques like breathing exercises or relaxation exercises, which we all kind of therapy sessions like CBT, cognitive behavioral therapy. In case if that is a mild case, okay, which once client or person practices this, they'll be easily able to deal with these kinds of phobias. Okay, or if the symptoms are severe, yeah, there are certain nice medicines so that we ask them. Okay, fine. Usually we give it to this people who are going to interviews or going to give a stage show. Okay, take a small pill that reduces your anxiety before half an hour before it. There are kind of medications even for this. Okay, it's not like every day you need to take. Yes, मेरे को पता है doctor. When I go there, I get a lot of panic. Take this half an hour before. Meanwhile, again, we'll ask them to practice relaxation kind of exercises to make sure this
Yes.
addressed.
So here's one important question that Priyanka has risen. Priyanka is a dietitian as well. Sir, can prolonged metabolic disorders like diabetes, maybe thyroid, etc., worsen depression? That is one. Two, Charu Malhotra ji puchte, I have nerve pain, uterus hypoplasia, diabetes, anxiety, sleep issues, chronic pelvis pain. All of these due to mental illnesses? Should I take medicine?
Right.
There are
A
two
very
different
interesting
questions
question.
there. Yeah.
Absolutely.
So,
See,
but
that
the point
is
is that physical disorders and that they leading to depression and depression leading to physical disorders.
it's both the ways. Yes, chronic diabetics, hypertensions, or any kind of chronic diseases, metabolic disorders, they are again the physical stress makes you vulnerable for psychological issues, right? They are also the risk of people developing depression or any kind of mental health issue when they have underlying chronic physical causes is high. At the same time, yes, as I said, depression may also cause or make a person land up in physical issues. It's both the ways. Okay, so now second important thing, yes, that is why we say the thyroid issues, vitamin deficiencies are more commonly seen things in depressed patients, actually, especially in women. We see a lot of cases like this. So make sure you have a health checkups quite frequently so that you're not rendering yourself vulnerable to these kinds of symptoms. It's the other way around as well. I'm feeling depressed. We advise them to take certain blood investigations just to rule out the physical causes of depression, right? So I think the answer should be yes. Of course, it's both the ways. It's very, it's not so easy to demarcate. A proper evaluation should be needed so that you get to know what is causing what.
Yes. Gayatri, I think a lot of your question, a lot of your symptoms have been addressed earlier. I think your answer is found there. Food and depression also we did talk about, but then binge eating, is it a sign of depression? And then weight gain due to medicines due of, while getting treated for depression, will I gain weight? These are two different issues that I wanted to address, Doctor.
So binge eating or stress eating is what we say, because they say when you're under stress, certain hormonal disturbances will make you increase your appetite, and that is where I see patients saying that, doctor, I was so stressed, I took a handful of sugar and I just got. So this is how the carbohydrate craving
No,
increases.
no, I totally understand because I went through these bouts where I was also binge eating for a uh, very, the strong periods which I keep getting into. Sheikh Sahil Ali ji bhi bolte hai ki I got addicted to ice cream. Now I am obese and now I'm depressed. So this is a cycle that we all fall into.
That's a right word, cycle. It becomes a viscous cycle. I stress, I eat, and I worry about my weight, and again I get depressed. It just becomes a cycle. Okay, as I said, see, there are certain reasons. Binge eating per se might not be considered as a sign of when it co-occurs with other signs like low mood and other things, probably yes, it might also be a sign of a symptom of depression. And coming to the medicines and weight gain, very importantly, I want all the viewers to understand there is two wrong notions we frequently. Doctor, your medicines make me very sleepy. Doctor, your medicines, will put on so much of a weight. Say, understand. We have past that age of psychiatry medicines, because you see it, and very unfortunately that psychiatry medicines have been portrayed in a wrong way. It's become a joke. Okay, go and join a mental hospital. It's become a joke at the
I know.
sensitivity we have
So we
towards
are
the
so
mental.
insensitive. Yes, pagal hai kya? Very normalizing mental health, not even normalizing it, trivializing mental health issues that we have been
Yeah. They
insensitive.
say, पागल है क्या ले एरगट लोग जाएगा. See, you see that casually using people usually, but the sensitivity we have towards the mental health is that is where that was the root cause for all the stigma. Okay, see, understand the medicines, treatment, psychiatrists, they're not going to harm you, they are going to improve the quality of life. Yeah, there are certain medicines which might increase weight gain, but that doesn't mean that every cycle. SSRIs, there are usually most commonly given for depression. So safe drugs. Even we prescribe it to pregnant women if they are in depression. So safe. Okay, right?
Oh,
So we need to come out of the thinking that psychiatric drugs or psychiatrists or psychologists or someone whom we should meet only when my life is half gone. No, please.
yes. So quickly, there are relationships which have gone sour, broken relationships, toxic relationships. I don't want to take names here because a lot of people have written their personal issues on, इसके वजह से हो रहा है, उसकी वजह से हो रहा है. When relationships are affecting quality of life, and if it is leading to a mental health issue, what do we do, especially broken relationships and toxic relationships?
Right. Very important question, because it is again pandemic relationships breaking or frequent turbulences in your relationship. So understand very importantly, that is where I personally, it is my opinion, like every individual should have enhance itself. It's not like my well-being is is guided by someone else's behaviors or what. Make sure you
करेक्ट, मेरे
have your.
हस्बैंड की वजह से मुझे हो रहा है, नहीं मेरा
Yes.
वेलबींग माई थिंग इज बिकॉज ऑफ मी. वहां प्रॉब्लम है, उनके वजह से मुझे प्रॉब्लम हो रही है, इज अ डिफरेंट थिंग. बट इफ आई वांट टू हेल्प माई सेल्फ, व्हाट डू आई डू?
Absolutely, that's what I'm. So that is where we should say yes. Definitely, there is a trigger. A partner should a constantly bothering partner is a trigger. The ideal way is, instead of jumping and dealing with the partner at the, just stabilize yourself first. Understand, yes, this is what is now, so that once you become stable, you can give a helping hand for the crisis relationship. Yes, let us speak about it. Let us meet a doctor or a counselor. Let us see whether we can get it addressed. Because again, a non-congenial home environment, it's like hell, because we do all kinds of works, come home, that is a place which should be treated as heaven. It's not a dustbin, right? Yeah. So understand, trying to enhance yourself, trying to be in a stable position, and trying to give a helping hand to the partner, so that come on, communicate and let us seek help if we feel that we are not able to deal with it. Is an ideal way to deal this, because that is again making, we see a lot of couple depressions. Doctor, we tried it for many years, doctor. Now we are both depressed, and my sexual life is totally off, and we are physically totally getting weak. So don't allow this pandemic to happen in the house. Okay,
Correct.
because
Yes.
get it addressed.
So yeah, there's so much that I wanted to talk to you about. I wanted to talk to you about grief. I wanted to talk to you about loss, personal losses, and how do we deal with it. But I think we're running short of time. So quickly, before I wrap up, what did COVID do to us? How did it affect our mental health? One quick thing, doctor.
See, COVID has taken a toll on our. See, one good thing I'll tell you what COVID have done is, yes, at least it made people think that there is something called mental health. We need to
Correct.
take care of it, right? because
Perfect.
it was never before into discussions. I can see normal families speaking about mental health. Are you feeling stressed? Are you feeling anxious? Okay, COVID मेरे को कुछ घबराहट हो रहा है डॉक्टर. Understand. Second thing, the bad thing, of course, it has taken a very bad toll on a lot of. We see a lot of depression, anxiety issues after COVID infections because, as I said, the environment which prevailed in the society itself was very traumatic, let me say, which made a lot of us vulnerable to these mental health issues.
Yes, doctor. So there is help, and there is so much of positivity out there. Can manage all of these. I think Mr. Lohit, brachial neuritis के बारे में आप जो पूछना चाहते हैं, doctor can be consulted on Apollo 24/7 app as well. For today, we need to conclude it here. So I would want you to give us top tips. What are the top tips and ways to manage depression, please?
Thank you. The top tip one is you should know or you should be aware of the signs of depression, which is very important to improve your quality of life. Second, lack of energy, lack of interest in previously pleasurable activities, and pervasive low mood for a long time. These are the fundamental three cardinal signs you need to look forward so that you seek a professional help immediately if you're experiencing this for a long time. Third important thing, understand a lifestyle makes a major role to reduce the vulnerability of depression or making your quality or life quality to the next level. So make sure you have a proper lifestyle, physical activity in place, those with medicines or those without medicines. Yes, the lifestyle plays an equally important role as the medicines do.
Thank you, Dr. Bharghav Sirivelu. That was a really interesting session, and there's so many people who are thanking you on this chat platform. On behalf of all the audience, I thank you once again because they are saying that this is such a valuable information that you have shared today. Thank you once again.
Thank you very much, and I thank all the viewers. Yeah.
Yes, doctor. So that is Dr. Bharghav Sirivelu who answered your questions. Now I'm going to get up, give you 3 questions, health quiz coming up your way. Please answer your questions on YouTube chat only. Winner's name will be announced towards the end of this show. And once you're declared as a winner, you have to write back to us with your contact details at marketing@apollo247.com. And the winners will be selected at the sole discretion of Apollo 2017. The gift vouchers will be shared with you once you write to us and then claim your gift. चलिए आज के 3 questions screen पर है, and also I'm going to ask your questions. Question number 1, please state true or false, depression and anxiety are the same. Is it true or false? Question number 2, fill in the blanks. Depression is a dash blank disorder. Please fill what disorder is this. Question number 3, Apollo 24/7 Circle membership is a premium dash program. What? Please fill in the blank there again. Question number 1, true or false में answer दीजिए. Depression and anxiety, are these the same? Question number 2 and 3, fill in the blanks please. Depression is a dash or blank disorder. Question number 3, Apollo 24/7's membership, Circle membership is a premium dash blank again their program. What is it? So I'm waiting for your answers. There are a lot of people, false, heart syndrome, false. Okay, let's see what is a right answer and then who are the winners for today. And while our team is selecting the winners, let me give you away the discount vouchers and coupons. Here's the first one that we are giving you this week. It is the first VC doctor consultations direct from Apollo at flat 150 rupees off on the first online doctor consultation. अगर आपको Dr. Bharghav Sirivelu जी से consultation लेना है तो use this code first VC and do get this 150 rupees off. And then also there's another code that we're giving away today. It is first 3 direct from Apollo order medicines. You order medicines and you get flat 25% off on the online medicine orders. This is valid on the first 3 orders. So again, order through your app, download Apollo 24/7 and then order, use the code first3. Exclusively for all these wonderful people who have joined us on this show, Health Hour, we are giving you this coupon, which is an exclusive coupon. You can use this coupon in addition to the other coupons that we had given. Use the code HH247, get up to 199 rupees off on online doctor consultations from Apollo 24/7, and also 20% off on medicine orders. So go ahead, download the app, use these coupons, and make sure that you get the right help. And while I'm waiting for the winners for today, let me tell you, next week we are talking about an interesting topic as well. How do we cope with blood pressure, that is hypertension? Because blood pressure is gateway to many more things. And I know a lot of people do manage blood pressure, but how much of medication, what dose of medication, when to consult, and what is a trigger point and warning? All these questions will be answered next week, and we are going to have Dr. Srimati Venkatesh, who's going to be our Apollo's health expert. Join us. If you don't want to miss this, subscribe कीजिए Apollo 24/7 का YouTube channel. Do follow us on our socials, Apollo 24/7, Instagram and Facebook. And also make sure that your notifications are on so that you don't miss a session, which is a very valuable session. And the winners are here. The winners are Vasupalli Satyaprasad, Aparna Bhatia, and Abhishek Agarwal. Congratulations. Winners, your names are also put in the YouTube chat box. If you are the winner, please write back to us and claim your gift voucher. Thank you all of you for joining us on this Sunday morning. Next week we shall see you. Namaskar.